symptoms of autism emerge in the first 3 years of life. We don't know exactly when. And so to address this question, a few years ago, we did a small study in our clinic when we asked parents of children who came for a differential diagnosis with their children, when did they begin to worry about their child's development? And now, as you can see here on the x-axis, we have the age of the child starting at birth and ending at about the second birthday. And as you can see, the distribution of parental age of concern is very broad, with some parents worrying shortly after birth, others not noticing abnormalities until after the first birthday, and still other parents saying, you know, everything seemed to be going okay until almost the second birthday. Now, so when we look at this, when this graph, a question presents itself, well, why? Why is there such variability in the report of the parental, when parents begin to notice the first abnormalities? Why there's such variability? Do parents simply differ in terms of how perceptive they are, or perhaps there's something else at play? And in fact, when we reviewed literature on onset of autism, there are several interesting things which come to the foreground. First of all, there appears to be several patterns of onset of autism. First one is called the early onset, and it maps pretty well on what Kenner described in his initial cases, saying that autism is innate and abnormalities in social domain can be noticed already within the first weeks, if not months, of life. However, a few years later, Eisenberg and Kenner noticed that, well, perhaps this is true, but also they found another group of patients who seem to be developing typically until the age of, let's say, 18, maybe 20 months, and then gradually or suddenly they seem to lose the words they were developing, and they seem to withdraw from the social interaction world. They call this phenomenon a setback phenomenon or aggression, and current estimates suggest that there might be about 15 to 30% of cases with autism who experience this particular type of onset. Still, if we look a little closer at the development of children with autism, we also hear reports from parents that the child might have be developing all right until about 12 months, maybe 14 months, but then nothing happened. As if a child reached a certain plateau or their development stagnated, and they cease to acquire new words, they cease to acquire new social skills, and for a long time there's nothing new happening in development, and we call it a plateau pattern. Now, this is quite fascinating. However, I must tell you that we don't quite understand these patterns of growth. We don't know whether these patterns of onset are in any way associated with, let's say, specific etiological mechanisms. Are they associated with a different developmental trajectory and outcome in these children? And the reason why it's happening is that for many, many years, in order to study the earliest expression of autism, we had to rely almost exclusively on parental retrospective report or on reviewing videotapes or video diaries recorded when children were very little, and then when the child was diagnosed with autism, someone could go back and review this diary and see whether certain abnormalities could be apparent or not. Now, there are a lot of advantages to these kind of retrospective methods, but there are also many methodological problems, most of them having to do with selection bias of the information we collect. So there's a new methodology around which has become extremely popular in the past, I would say 5, maybe 10 years. This is the idea of studying autism in statu nascendi, as it evolves. But in order to do that, remember that we typically do not diagnose autism until later, in the second or third or fourth year of life. So how can we actually study development in the first year of life, right? It's a very it's a complicated question, but it turns out that genetic findings suggest that once a child is diagnosed with autism in a given family, the recurrence risk of autism in the same family is much greater than we would expect in general population. As you heard, autism has a very strong genetic component, and for that reason, we expect this increased recurrence rate within the same family. The recurrence rate estimates right now are about 5 to 10%. That might change as the new studies come to fruition. It may actually go a little up, but the conservative estimate is probably between 5 and 10%. Now, so these younger siblings of children with autism are at higher risk of developing autism, autism-related disorders, and they also might have experienced some delays in language, cognition, and social functioning, which do not meet